In a society filled with baby showers, birth announcements, and celebrity pregnancy news, if you long for a child but are having trouble conceiving, each day can bring disappointment. But hope is on the horizon. With advances in medicine in this modern age, more and more women are becoming mothers. Here with information on how you can get help when facing infertility is Dr. Margaret Graf Garrissey. She is the medical director for the Institute of Reproductive Medicine and Science at St. Barnabas. Hello, doctor.
Good morning.
Welcome to the show.
Thank you very much.
So if I'm having trouble conceiving, at what point, how long do I know is too long? And at what point should I make a move?
Since female age determines the pregnancy success with any treatment, we usually advise if a woman is less than 35 years old and she doesn't suspect any problems, that she should probably try for a year before she seeks infertility treatment.
Okay.
Normal human reproduction isn't very efficient. If you took 100 normal couples not using birth control, only 15 out of 100 will conceive the very first month they tried. But at the end of a year, 80 of those 100 couples would have gotten pregnant.
Okay.
However, if the wife is over 35 and she's not pregnant in 6 months, again, because that biologic clock is really ticking, she should start seeking evaluation as to why she's not getting pregnant sooner, like after 6 months of trying.
Okay.
Many women have gynecologists who are interested in infertility and might start some of the initial testing, like a sperm test on the husband or hormone tests on the wife, or something like an x-ray to see if the wife's tubes are open. So it's fine for a woman to start initial testing and even some simple treatments like medications if she's not getting regular periods with their gynecologist. But I would say many gynecologists are not interested in infertility, so as soon as the woman brings this problem up to her gynecologist, he or she might refer them to a specialist in infertility immediately because they don't have the time or interest in infertility, and that's totally appropriate, and of course we encourage that. If a woman stays for testing and treatment with her GYN, she probably, and she's not pregnant within 6 months, she probably should ask her GYN to send her to a full service infertility practice.
Okay, so normal time is a year for a normal woman under the age of 35. We shouldn't start panicking.
Correct.
At
Correct.
2 months, say I'm not pregnant yet, what's happening?
With the caveat that if you suspect something, like if you're under 35 but you get 2 periods a year, that's not normal.
Okay.
So you shouldn't wait the whole year because maybe you're only getting 1 or 2 chances. I'm talking if you have a regular
Normal.
monthly menstrual cycle and there's nothing suspicious in your history, you can try a year.
Okay.
But if your husband suspects there might be a problem because he had undescended testis as a baby and had surgery for that, and they're wondering if there might be a sperm problem, or the wife doesn't get periods, or she had a ruptured appendix and had surgery and she's worried about scar tissue on her tubes. If there's anything funny in their history, they don't wait the 6 to 12 months. They see someone sooner.
Go right away if you have medical issues.
Right,
then.
right.
Okay, now if I go to a specialist, what are some of the things that I can expect on my first visit?
On the first visit, I mean, I could speak for myself and probably most infertility specialists, but because it is a couple wanting to have a child, I almost always want to see the couple. I want to see the husband and the wife together.
I like that.
I want to talk to them. It's a little more complicated than just a woman going to her GYN for a pap smear. So we take a lengthy history about any things about the woman's menstrual cycle, about medication used by either partner, about any surgery or problems the husband has had in the past.
Okay.
So a lot of time is spent on the history, particularly if they've seen other fertility specialists and had other treatments before coming to you.
Right.
That time period of reviewing prior testing, prior treatments can actually make the consultation quite lengthy. It's also a great time to educate the couple on possible causes of infertility.
That was my next question.
Of normal human reproduction. You know, I've seen people who've just been trying for 3 months and
What are
already
some
made
of
an
those
appointment.
statistics? I'm sorry.
Okay. Once you get up to the point of being tested and seeing someone, the couple is often quite surprised, as is the public, that 40% of infertility is actually a sperm problem.
Really?
You know, it's a woman who's pregnant, so everyone always assumes it's just the female, which is why it's important to meet the couple and explain that.
So 40% is a pretty high number.
Yes, and so obviously one of the first tests that would be done is a sperm test on the husband to see if there's a problem and see if their problem is in that 40%.
Okay.
Approximately 30% of infertility is ovulatory dysfunction and irregular menstrual cycles in the wife or a hormone imbalance.
Okay.
Another 20% is anatomic problems in the wife. Blocked tubes from an infection or having a tube taken out for a tubal pregnancy, you know, other kinds of anatomic things of the uterus or the tubes. So that gets you up to 90. 40 and 30 and 20 is 90. 10% of infertility is actually unknown and unexplained. That the infertility specialist does all the tests on a couple and he actually can't find anything wrong with them. But there is still great treatment options available for the normal infertile couple.
For the normal infertile couple?
Yes.
Wow. Now, so say some of the things, if it's not the 40% and the other 40% or 30%, what are some of the other things that could, are lifestyle changes some of the things that I can affect change to make this happen?
Okay. I would say maybe I'm seeing a very more privileged population, but I have to say most of the patients that I see seem to be eating well, exercising properly, that there's not something that I should say eat yogurt or do yoga or whatever, that I think there's moderation, and if you have a healthy lifestyle, there's nothing more that you can do for that. I would say in terms of lifestyle modifications that obviously if there are drugs or alcohol or other not healthy things for you, smoking, you should absolutely stop smoking, just like smoking is not good for your health in many areas of your life. It's also not good for trying to get pregnant. If you're seriously obese and overweight, obesity can lead to problems both with sperm problems, with ovulatory function in the wife. So if you're seriously overweight, not just 10 pounds, but seriously overweight, weight loss would be a very important thing. Quitting smoking would be a very important thing in terms of lifestyle changes.
So those directly affect my ability.
And lifestyle, meaning also social interactions, that I would recommend that while women have the opportunities for education and career now, which I obviously have enjoyed myself. I love my career, but I love being a mother. And so you can have it all, but if you want, you need to be thinking about that earlier. That I would say, not forgetting. The saddest thing to me is when, say, someone 40 comes to my office that like forgot to date, or they forgot to put having a family as a priority in their life. So in terms of lifestyle, not being a well-rounded person and not ignoring the social and family things that should be important into your life. There's a lot more to life for many people, not all people, than their career.
Than just working.
Than just a job. And
well,
I think especially for women, that lifestyle changes, that while they're on the fast track, education and career-wise, they don't forget their love life, their social life, their family.
That's a critical, so important tip. Thank you.